My experience with using red light, personally had to use it after a injury, has been also to increase blood flow and oxygenation to parts of the body where I needed it most, right? You have the foundation, you have the sleep, you have the nutrition, you have the exercise. But this is where adding on these tools really can be valuable.
Breaking the gray.
Welcome back to the Rebel Sciences podcast. I'm your host, Chantel, here with my co-host, Sarah Turner from Sarah Thrive. Hi, Sarah.
Hi, Chantel. Nice to see you again.
Nice to see you. And it's a whole brand new week, and we are so excited to have today's guest, Dr. Monisha Bhanote, quintuple, board-certified, integrative pathologist and founder of Cell Care. She's here to show us why true health starts deep inside ourselves. So let's get into it. Hi, welcome.
Hi, thank you so much, Sarah. It's so nice to see you again and to speak with everybody. And I'm excited about this conversation.
Yeah, great. It's fabulous.
We're so excited to have you today. And I think you have so much knowledge, obviously, in various fields of health and wellness in general. So I thought the first question we could sort of dive into is, seeing as though you've been in the traditional medical world, what made you step away and focus on integrative medicine and getting a bit deep into the root causes of disease in general?
Yeah, great question. So I actually haven't stepped away. I've just expanded my, resources for healing, right? So it's not quite about stepping away. My background is as a pathologist, and many people don't even know what that is. Like if I use that word, they're like, oh, so you do autopsies. And I'm like, well, no, not actually. I mean, yes, I've done them, but the truth of the matter is that pathology is the diagnosis of disease on a microscopic cellular level. So we are looking at, the tissues, the body fluids, everything that's in the human body, and seeing these cellular changes that happen from a healthy cell to a disease cell. And I have 5 medical board certifications, but 3 of them are in pathology, where we're looking at anatomic pathology. That is your tissue. That is, if you go for a breast biopsy or you go for a lung biopsy or a colonoscopy and you get a colon polyp taken out, we're looking at the actual tissues, all the way to organs being taken out. Whereas clinical pathology is all of your blood work. So we're thinking, you go get your labs drawn, and so it can be your urine, your blood work from plasma to other body fluids. And then we move into cytopathology, which is literally looking at single cells to see that they've made a disease. And that could be anything from your pap smear to urine analysis or actually urine cytology, to then also looking at body cavity fluids, which is your pleural fluids, your ascites fluids. And my favorite part is fine needle aspirations, which is literally taking a little tiny needle, putting it into a palpable mass, or if I'm working with a radiologist, they put it in, to a non-palpable mass. But from those few cells, we can diagnose disease. And that's what I've been doing for a really, really long time. And what made me expand my knowledge base was that as I'm doing this and I'm working with my colleagues, because pathologists are really considered doctors. We're giving the diagnosis, we're giving the answer. So then the other clinicians can go and figure out what is the treatment guidelines for this health condition. And with that, spending literally years and years and decades sitting in a conference room where I'm with, say, the surgeon, I'm with the oncologist, I'm with the radiologist, radiation oncology, all these different clinicians, and we're talking about these patients' cases, and they're getting the treatments that are recommended by the guidelines. But then I'm seeing those same patients come back 2 years later, maybe with a recurrence, maybe with something different. And I'm thinking to myself, I'm like, well, wait a minute. what's going on here? Like, why aren't they getting better? And if you actually look, um, because people are really told to that the treatment is done, go home and keep living your life, right? And that is where the gap in the system is, and that's where I think truly integrative has a major place. Which integrative is not alternative medicine, at least not in my opinion. It is not alternative medicine. It's really complementary medicine. So we take the best of what conventional has, and then we take the best of what ancient wisdom and all these other holistic approaches, whether that be Ayurveda, whether that be traditional Chinese medicine, whether that be integrative botanical medicine, like all of these things, and put them together with what we know and help the patient and individual personalize their healing protocols. And that's how I see it. And so, of course, I had to train in that. That didn't like, yes, the curiosity came from going, all right, these cells that I talk about when it comes to cellular health, these cells are all angry, but how do we make angry cells healthy and happy so they're functional again? And I have that foundation because literally, I mean, millions of cells that I've looked at, but how do we layer that on with our lifestyle and these things that we're doing? And that's where my additional training in integrative medicine from the Andrew Weil Center for Integrative Medicine came from, and then culinary medicine and really using food as medicine and seeing how can we enhance our everyday meals too. Yeah.
That I didn't realize you had that background actually, Monisha, and it's really interesting. How do you go from that? I mean, it's very granular what you're saying. Like if you're taking these small samples, you're looking for disease states. How on earth do you integrate that then with things like Ayurveda when they've got a completely different diagnosis, or they're looking at the body very holistically? How do you go from that very granular approach to that holistic approach?
I guess it takes an understanding of both approaches and seeing, like, so for me, if I'm looking at an individual and I'm like, okay, they have digestive issues and, their biopsy demonstrates reflux, esophagitis, like I can clearly see that, and their stomach biopsy has a gastritis in it. They have the symptoms of it, and they, in conventional, are given, PPIs or a medication. I'm looking at it as, all right, what is causing this from a lifestyle perspective? How does Ayurveda, which Ayurveda basically looks at the body in, a unity of the mind, body, and spirit, but looking at it from a perspective of imbalances. And are there imbalances that this individual creates in them to create this increased acid reflux, and how can we reverse that? So then you go back to that microscopic going, all right, well, if we can give them this specific approach for their lifestyle, these herbs and supplements or foods that will not create harm down the road, because we know that PPI is one of the most prescribed medications, but it's also one of the ones that contributes to cardiovascular disease, kidney disease, and bone loss. So now imagine a patient has been on this for decades, and then they go to their doctor at 60 and they're like, oh, I got a DEXA scan and now I have osteopenia. Well, we didn't do the right thing there.
Mm.
So always first, as a physician, do no harm, right? And I think somewhere along the way, we kind of forgot about that. And then first do no harm, and then empower a patient or an individual to start healing themselves and providing them the tools. At the end of the day, a doctor is nothing more than a teacher. If you're not teaching your patients, then you're not doctoring.
Yeah, really like how you said that as well. And I wanted to ask you a little bit more about the triad of like the gut brain mitochondria connection, because in your work I've seen, obviously that's what you speak on quite a bit, and obviously at Sarah Thrive, the gut brain connection is very important. Could you maybe touch on why this triad is so important and how you use that, or keep that in mind when you're doing your work of seeing patients?
Yeah, absolutely. So first of all, it's when I'm talking to my patients, and we do this often, I'm like, all right, let me take you back to like ninth grade biology, because we all kind of blocked it out. We're like, well, we don't, why do we ever need to learn this stuff? And now you're going to know why we were supposed to learn it in the first place, right? So I like using my kind of cell model, right? And
Yeah.
in the cell model, we have, we've got 37 trillion cells. All these cells have a different function in our body. So our thyroid cells, do one thing, our gastric cells do another thing, our endometrial cells do another thing. I mean, they all have a very unique and actually quite beautiful function. But what happens as a whole in the body is these cells, from our everyday exposure, from the environmental toxins we have, from the ultra processed food that we have, can't function after some time. And you're not going to see this actually, you're beginning to see it a lot younger now, where, we have 1 in 3 millennials with chronic diseases, but you're maybe not even going to feel it for a while, right? Until all of a sudden you're like, oh, I've got a little bit of fatigue, or I'm not like waking up the way I used to, or I don't have the energy to stay up and do all the things that I used to do. And that's thanks to this subtle little organelle inside our cells called the mitochondria. Now, keep in mind, it's not just a mitochondria. There's endoplasmic reticulum in here. There's Golgi apparatus. There's lysosome. There's all different kinds of things in these cells. And for me, as a pathologist, when I was looking at these cells, you don't see like all these organelles. You can't see those without an electron microscope, honestly. But what I can see is the state of the nucleus. Okay. And the nucleus is where that houses our DNA. Okay. So if that nucleus is not healthy and happy, our DNA will not replicate properly. I can also see the structure of the cell membrane. The cell membrane is critical for communication back and forth between different cells, which, by the way, red light has an impact on the cell membrane, right? So when I'm kind of thinking about the gut-brain connection, I'm actually thinking about communication, and the communication that's happening between the gut and the brain via the vagus nerve, via this cellular communication that's happening, that is bidirectional, that is literally happening all the time, micro messages being sent. It goes much deeper than that, but for me, this is one of those that is the underlying connection that is majorly disrupted in individuals, and they don't realize it. And we're looking for all these external ways to heal, but without that foundation, you're kind of missing it. And in Ayurveda, and many people are beginning to open their eyes to that, the gut is kind of the source of both disease and healing.
A few things you said there, I would just like to explore. Firstly, how do you think the red light is affecting the mitochondrial membrane? And then secondly, you said that you can see the state of the cell. How are you looking at it?
Yeah, so in pathology, because we're looking at cells under the microscope, and the features we are looking at are things like NC ratio, which means nuclear cytoplasmic ratio. We're looking to see, all right, is the nucleus inside this cell, mind you, our cells are not this big, okay? First of all, people, our cells are not teeny tiny. I'm looking at them in a microscope, and I've got a 10x ocular times a 40x piece, so that I'm looking at it at a 400, 10 times 400 power, looking at these cells. Yeah. And blood cells, if I look at blood cells, I even have to go further. I have to do a 10 times 100 and do it in oil immersion, which is at 1,000, so we're looking at like really microscopic things. But the features that I'm looking at in these cells, when I'm looking at it and thinking, oh, is there abnormality here? Is this something that's becoming atypical? Is this something that is on its progression path to, say, dysplasia, which is precancerous? Is this cancer? Right? I'm looking at the nuclear features. It's a nuclear cytoplasmic ratio. In a cancer cell, this nucleus increases in size. Okay, so it increases so much that it starts taking over the space inside the cytoplasm. Now imagine if this increases in size, the other organelles that are there, like the mitochondria, are getting pushed out, meaning they're not there anymore, which is why when people have diseases, they don't have energy, right? Because the organelles aren't there anymore. So I'm looking at that function. I'm looking at nuclear chromatin, which is to see like, all right, is it hyperchromatic? Is it not? I'm looking at the cytoplasmic membrane to go, is it a smooth membrane? Is it wrinkled? Like some of the features like we see, like, for example, in papillary thyroid carcinoma is like this kind of wrinkled kind of membrane around there. We also see that in an HPV infection. So, pap smears. So there's all these subtleties we look at. Then we look at, are the cells organized? Like, if this cell is a healthy cell and the cell next to it is healthy, they kind of have a nice organization. Think of it like as an organization where everybody knows where they're supposed to be. So say you are at an airport and you are standing in line to get on the plane. Okay. Say American Airlines has like, okay, here's for priority passengers, here's for this, and everybody's standing in a line. That is healthy cells, healthy humans, right? But now, say for example, like the cells are not healthy and they are disorganized. That's actually the chaos we see in most airports, like Southwest, like everybody's like all over the place and it's just like everybody trying to get in. That's really what's going on with us.
Right.
So, the haphazard organization of the cells just, first of all, they won't communicate when they're haphazard, but now they've got, connective tissue between them and inflammatory cells going there. And it's just complete chaos under the microscope. But this is like, my bread and butter. This is what I've been looking at. And I'm like, I could easily spend my entire life just sitting there and giving the correct diagnosis, which first of all is key, and handing it off to a clinician so they can treat. But here's the thing is, I know something that I can't, like, I don't want to say hide anymore, but I know that those changes are both reversible and preventable by lifestyle, which is why I do what I do now, integrative pathology, in the search of like, really looking for that longevity aspect on the cellular level. I mean, I don't think anybody can say they actually look at cells, like not many people other than me, because that's actually what
I never heard of people talking about it before, for sure.
No. Everybody loves talking about cellular health, but have they actually held the tissue in their hands, looked at the cells?
Mm-hmm. That's amazing. I wanted to actually ask you also about the mitochondria a little bit more specifically, on because you mentioned longevity, and obviously that's such a big buzzword, and some people know what it does. Some people, like varying scales. But how does supporting them change how we age, how we deal with information, or how our body can deal with information, and also how you target, say, something like inflammation? If you have any more detailed descriptions of how you were explaining, that'd be so nice.
Yeah. So most people think of the mitochondria inside the cell as just to produce energy. Okay. That is just one aspect of it. Mitochondria also are responsible for cell signaling, so that communication. They are responsible for your immune function. They are responsible for detoxifying the body. They are responsible for hormone production. They're responsible for cell death, right? Apoptosis. So when a cell dies, what happens with a cancer cell? Cancer cell does not like to die. It loses its mechanism to recognize how to die. Cancer patients have mitochondrial dysfunction. Now imagine if you could test for that early. Pretty much every disease that we're thinking about, chronic diseases like neurodegenerative diseases, Alzheimer's, Parkinson's, all our metabolic disorders, the insulin resistance, diabetes, all of this, all the way to cardiovascular disease, which pretty much every other person has, is affected by the mitochondria. So what can the mitochondria do? The mitochondria help with the ATP and making energy. There's no doubt about that. But remember when I said that the mitochondria and red light and all of this is impacting other parts of the cell? and specifically the cell membrane, right? So the outer side of the cell, what it's doing there is it's kind of like our cells have a electric potential, right? And through calcium channels, there's like if you kind of imagine like looking deep down in this, and no, we can't see calcium channels in a regular microscope, but we can see them in electron microscopes, which go even deeper. But red light will influence this electrical potential, which is super cool, thereby influencing mitochondria, right? In a way, the red light can also, I've been talking a little bit about structurally, but it can also impact biochemically, right? So now we're activating transcription factors in our cells that can affect things like NF kappa, all these different things that will get activated. And when they're activated, they could issue cell repair, right? They can be antioxidant defenses. Like I'm all about oxidative stress and preventing it as much as possible. Most people are like, oh yeah, I'm really stressed. And I'm like, are you stressed or do you have oxidative stress? Like there's a difference here. So my experience with using red light, because I've personally had to use it after a injury, has been also to increase blood flow and oxygenation to parts of the body where I needed it most, right? So when we're thinking about injured tissues and really getting the nutrients in there, yeah, you have the foundation, you have the sleep, you have the nutrition, you have the exercise. But this is where adding on these tools really can be valuable. And because of our modern lifestyles, I don't think it's a matter of choice of saying, oh, this is just another, hack or something. I think this is another necessity because we are now indoors more than ever. So we don't have that natural recharging we would get from the sun. Okay. We are in front of a blue light from our iPads to our computers to our, like all this light, more so than ever. So we need that counterbalancing of the red light to kind of help. We have the most ultra processed diet. I mean, we don't even have food on the market anymore. And just because it's in a grocery store does not mean it's food, right? This is just chemicals sitting there. So our body is basically a walking toxin bomb that we need to start stripping the layers of all these different things and going, all right, what is it can I do? And what I really work with is, the practice of not necessarily making more to do. But I talk about it in my book a lot, is about the practice of going from habits, routines to rituals, and kind of placing these things into your life in a way that is more meaningful. And to me, when I think of habits, I always think of like, oh, I've got this bad habit, I really got to give it up. Nobody talks about good habits. I mean, rarely, okay? Or routine is more of that burnout, like, oh, I got to go to the gym. I'm going 5 days a week. I've got to do this. And you do it for a while, but then you're like, I don't really want to do this. And so I really like to use the concept of rituals. And for me, that's really being more self-aware, more intentional. Like, okay, I'm waking up today and paying attention to the cell signals that my body is giving me, like the way my body is communicating. And this is what my body needs today. And why I feel that works better is because if you don't do something, you don't feel bad that you didn't do it. Because I think with the whole like habits and routines, we feel really bad if we miss a day at the gym, as opposed to waking up and going, this is what my body needs today. I didn't get enough sleep, so maybe I need more rest, or I feel like maybe I need to move my body more because it's feeling stiff. Maybe I need some red light because so really building in these rituals of practice so they're almost seamless in our life is kind of, I think, a better way to live.
I have a lot of technical questions I want to ask you, but what's coming up for me is, an argument that I had with myself this morning.
Okay.
So this morning I had an argument with myself. I had an Easter egg left. I wanted the Easter egg for breakfast. And I was thinking, what is, one of me wants the Easter egg for breakfast. The kind of biohackers saying, no, Sarah, you need to have, real eggs, get your protein, the whole thing. Anyway, I ended up eating the Easter egg.
What was it, milk chocolate or dark chocolate?
It was dark chocolate.
Okay. All right.
But
So you got some theobromine. You're fine.
Magnesium, the whole thing. But the question is, how do you discern the messages? Because I totally am with you, and I understand, and I really like your idea of kind of feeling from a cellular point of view what you want. But sometimes you are getting mixed messages from your body. I was getting two very clear and distinct messages from myself. And so how do you kind of, because I think for a lot of us, if you kind of thought, do I want to go to the gym or don't I? It's hard to kind of get a very clear message about what's good for you as opposed to what's comfortable for you.
Yes. Yeah. So I'll answer both of those, the gym and the Easter egg. Okay.
Right, yeah.
Chocolate is many people's vices, right? But first of all, I would think about it as like, are you just having the egg because it's there, because it's only once a year? And being okay with the fact that, oh, you know what, I'm going to have an egg and my body's not going to break down because I'm going to make sure my next meal is full of dark leafy greens and antioxidants and rainbow colored and all this, right? And it's that internal battle that we have created to make guilt from something that is normal, right? But now if you're like, I have 30 Easter eggs and I'm going to eat one every single day, then it's like a different conversation, right? So I think that comes back to, all right, a lot of this is immediate gratification. Am I going to feel good with myself after I have the egg? And if I am, then yeah, go ahead and have it. But if you're going to continue eating, it's kind of like the thing around Halloween candy, right? Are you going to eat the whole bag of Halloween candy or just the one? And that's where I think the signals you're paying attention to is not just the physical cues of, am I hungry? Do I have energy? But it's also the internal mental narrative you're creating for yourself of, is this the right thing? Like, because we talk to ourselves about these things, right? Like, am I doing this and it's right for me? Am I going to have the Easter egg and still be able to do all the things I need to do throughout the day to make it a successful day? Or am I going to eat? Yeah.
No, I totally get it, and I'm with you. And I was kind of, that's just one silly example, but it's really about how do you, because I think we've lost it a little bit. We've lost a little bit of our intuition around our bodies.
Yeah.
And I think that's a problem for a lot of people, is that we're doing things because we either feel we have to or it's just become a bad habit. But I for one would like to kind of think, I'm doing something from a point of view of actually listening to my cellular biology. I'm just very interested in how you teach people.
Well, I teach a lot of it in my book, 95,000 words of it. So,
right. Read the book is what you're saying.
Well, no, I mean, here's the thing. It's a little bit more nuanced than that, because when I'm teaching about it and I'm teaching about how your gut functions, from how you break down food and you digest it, to how your brain waves function when you're sleeping, to how your muscles function when you are or are not doing activity. But I'm explaining to you the cells that are there and the cells that are communicating. And to answer that second part of the question, because you mentioned the whole like going to the gym again, and I think that is another big one for people, is when you're waking up and your body is feeling like tight and achy and your joints are just feeling more stiff, what do many people do? They're like, you know what, I'm just not going to move. I'm just not going to exercise, right? But that is actually the opposite of what you should be doing, because if you think about the tissue, and I know most people don't think about their tissues and their cells, this is just my world and the way I communicate, but I will tell you, my patients start thinking about it this way. Our cartilage, which is a specific type of a tissue that covers, say, your hip bone, or it cover like your femur, or it covers your humerus, or your knee bones, all this stuff. The cartilage does not have a blood supply. The only way for the cartilage to get nutrients is for you to move your body. So the synovial fluid can go and nurture this space, right? So if you're just sitting and not moving, how are you going to get all that stuff there? Additionally, one of the things, and like I said, I do talk about this in my book, is the fascia, which is absolutely critical. And when I think of from a red light perspective and overall, well, the fascia is basically your Spider-Man suit, right? And it's this very thin connective tissue underlying that kind of surrounds all of your body, your tissues, your organs. And this fascia is super sensitive, first of all, to toxins. It's super sensitive to dehydration. So when somebody tells me they have pain, I'm like, well, let's see. Why don't we start with hydrating, right? Because a lot of the medications on the market are dehydrating. The caffeine you're drinking with your coffee, is dehydrating. Let's hydrate your tissues and see where the pain is, because there are pain receptors in your fascia, right? And if you've now taken this nice, beautiful Spider-Man suit and you shrunk it down and it's not where it should be, of course it's going to have more pain. That's where that pain in our shoulders and all of that comes to. So when I'm talking about cell signals, I'm talking about some things that are happening that if you're experiencing a symptom of like pain or a headache or bloating, that is your body communicating with you on a cellular level.
Do you have any more technical ones you want to throw in, Sarah? I was going to ask a few
Well,
more
I'm going to
about.
let you go. No, I do have a lot of technical, but I'm going to let you go next, Chantel. It's just funny that I was kind of having that conversation with myself this morning. Like, how do you kind of know? How do you get that? I think that, like, I was thinking, we kind of lost the intuition of what we should do and what's good. Like, even from eating plants, if you're just getting it from a supermarket, you've lost the intuition. I went out
goodness.
and I made
Can I
stinging
tell
nettle
you?
cake the other day. So you just forget. My nephews are like, you can't eat that. That's a weed. I'm like, you can eat that. We're making stinging nettle cake.
Goodness. Oh, that's a whole nother conversation about eating plants. Like, don't get me started on that. But like, I'm just thinking about, like the other day I picked up some organic strawberries from the store and stuff, and I'm like, eating them, and I'm like, gosh, these have no flavor. They taste like water, right? And luckily you're abroad, and I don't know how it is in the UK, but I can tell you in the US, our food is not food. And I know that because when I travel to other countries, I do a lot of traveling, and eating like real food that's literally been picked from like, all these different farms and stuff, and you can actually taste the food. And then you go get something from the grocery store here in the US, and I'm like, this is not what a strawberry should taste like. I think there was like one good strawberry out of all 20 of them in there. I'm like, okay, this is the only one that actually had some flavor. The rest were just like water. I'm like, I'm just eating fiber and water, which is fine, but it just tells you that we have some work to do on our planet to really create the health we want. It's not this like, oh, let's just go biohack this and do this. No, this is a planetary evolution that it needs to happen now.
Yeah, and I think something that also just jumps out for me, because I forget when we travel a lot sometimes, like I love getting my hands dirty in the soil, but it's because I feel extremely grounded and connected. And also what Sarah was saying about the herbs, and also just touching a little bit on like female hormones at certain times, and the way that your mind is and your emotions. And I actually just wanted to revert back to that a little bit and ask you, like when you have a garden and you start sort of touching into that ancient wisdom, I'm always looking at what herb I could maybe drink more of when I am in a space where there's a garden, like nettle tea or lemon balm and all these things. But I think about the modern day society and how what Sarah is just saying now, on a day-to-day basis, how many people are constantly just on like the rat race, and the stress that comes without you realizing it. So I actually just wanted to ask you regarding that, like with our nervous systems and how you deal with people's mental and emotional states and help them shift that alongside it on a cellular level, because obviously a lot of that's coming from yourselves. But I always find that interesting. I'm always like, wait, is this an emotional thing? Is this a physical thing? And it's hard to sometimes decipher that by yourself, even if you have all the
Yeah.
tools. I think
And,
it's a tricky one.
and I don't think, you need to necessarily separate it out. Is this an emotional thing? Is it physical? It's you, it's your body. And when I think about like how I help people with this, because ancient wisdom has not disconnected the mind, body, and spirit. It's all one. Whereas our conventional has siloed every single organ system. Well, I can tell you right now, they don't act in individuality. That communication is continuous. So when I'm working with, say, nervous system dysregulation with a patient, depending on where that patient is in their journey, I have some very, very educated patients. And they've listened to all the podcasts, they've read all the books and all of this stuff. And so for them, I might be having the conversation about your amygdala getting hijacked, and they'll know what I'm talking about. But then an individual who maybe is new to this journey of like, oh my god, it's not just about going to the doctors and getting a medication, it's about understanding what's going on in my body. We take it from a much more easier to understand level, where it's like, okay, you've got these cells. The cells are what make up your body. And when, say, your hormones are off, you were asking about women's health, this is, the hormones that are being released in your body. Your body might have a little bit of extra dominance. This is created from our lifestyle, right? You might be estrogen dominant, which creates an irregular period, or maybe makes fibroids, or all these different things. And then when you start talking to them about it, and then really examining their lifestyle, and we do this, I'm like, so let's talk about what you do in 24 hours of your day. What does your day look like? You are like, what time of day are you waking up? Are we waking up when the sunrise? When are you having your meals? Like, are you eating late at night? Like all these different things that are that foundation. I mean, even with some people, like it's really interesting, because there is a generation out there of people who are in their, I would say, late 60s, who didn't learn anything about the way the human body works. So I do a lot of gut microbiome testing, and I'm like, why do you guys have these bugs in your GI tract? Makes no sense. And if you have the conversation of how they go to the bathroom and which way they wipe, forward or backwards, it's like mind blowing, right? So these are things that, no, I'm serious, like things that are common sense, but not necessarily if you haven't been taught it, because you only know what you've been taught by your parents, your school teachers, and your friends.
Yeah. And a lot of the stuff that you do focuses on the gut, right? Because when we're talking about things, you need to know where to start. And it's something that I mean, with my device, I also think that the gut is very important. Do you always think that's the starting place, the gut? Or do you kind of...
I do think the gut plays probably one of the most major roles. And the reason is because it's also modifiable, right? In a way that, okay, if some people are like, oh, it's your genes, I'm like, well, actually, no, 95% of cancer is not genes. But we are all eating every day. Unless you're not eating, then yeah, maybe we don't need to talk about your gut, but everybody's eating, right? And your next meal can change the trajectory of your health in a good way or a not so good way. And microbiome science is relatively very new, and it's absolutely fascinating what's going on in microbiome science. But the fact that we have these, organisms living inside our body more than we have human cells. We actually have more organisms, microbiota in our system, that can help you make vitamins, that can help you make hormones, that can help break down enzymes. Is just like mind blowing that nobody was talking about this, and it's because it's new, right? I didn't learn about this in medical school or what, and but when you can see it in an individual, and you see, all right, these are the bacteria they have, this is the type of inflammatory markers they have, this is what's going on in their gut, and you can modify it both through lifestyle, supplementation, botanicals, herbs, all these different things without a single medication, and red light, right? And all these different tools, you can modify it and you can actually see the results. I mean, it's pretty like darn like, all right, we're coming back to the foundation of what's going on in our inner ecosystem. And it was pretty cool because I had the chance, I do my own retreats. And at my last retreat, we had your device. Right. So we had the Sarah Thrive device and we had everybody sign up for their days of like trying this device out and sitting in this nice, beautiful room where they're doing it. And I'm talking to the people after it. I'm like, so what did you feel? And they're like, I actually felt like something started awakening in my gut. And I'm like, well, yeah, because your gut has been pretty like inflamed and suppressed. So now it's like starting to communicate, right? So there's this communication that starts getting re-energized, not just from the food, because obviously my retreats are plant-based, so we have the food going on and now we've got this red light added in. And it was just really like amazing to see these people who are like, wow, I didn't know the power of healing and I didn't know what it felt like in my body. And that's where I think retreats are an amazing avenue to create this, because you're not thinking about, all right, what's going on with work. You're just kind of focused on listening to your body and listening to your cells, and you can tune into them.
Yeah.
When is the next retreat? Because I know we're touching on home as well. Then you mentioned it's a women's retreat.
Our next retreat is in October in the Azores, which are these beautiful kind of islands off the coast of Portugal, which is, nature truly is healing. And I couldn't imagine a more beautiful place to like breathe in the fresh air and kind of try different healings and just really being out in nature.
What is the focus of the full retreat? Like if you could give just a little rough summary of what.
Yeah. So there's a wait list going for it, but this specific one for this one is a women's health, women's longevity retreat, focusing on detoxing the mind, the gut, all the things in detoxing without giving up food, really, because I don't believe in that. So, but really kind of clearing out the cellular gunk, whether that's in our mind or our body.
For sure. That's great. So maybe we should just tell people a bit. They can find you at the retreat, although that one's probably booked, but I'm sure you've got other ones. And then you're going to do talks in London and maybe even Estonia. We don't know yet.
Well, we'll see about that one. But yeah, so I'm easily found. My website is drbhanote.com. I do take a certain number of patients every month. So you can go to the patient aspect of that. And then also on social media, I'm Dr. Bhanote. So whether that's Instagram, Facebook, YouTube, LinkedIn, Pinterest, everywhere, it's the same, Dr. Bhanote. I'm usually traveling to speak, so I know this podcast won't be out for this weekend speaking, but in June I will be in the UK. I'll be speaking at the Integrative Personalized Medicine Symposium in Westminster, which is super, super cool. Mm-hmm. And then I will be also in Quebec in June. If anybody's around and wants to go forest bathing with me in the Quebec mountains. And then just stay on my radar on my website. I have my newsletter, which goes out weekly, which provides you a new cell care ritual every week, as well as a new recipe every week. So, and deep dive science where I'm talking about the cells so you can understand and learn a little bit more. And then, of course, you can pick up my book, The Anatomy of Well-Being.
Yes,
that is on Amazon, Barnes & Noble, all the book resellers. Yeah.
Amazing.
Yeah, fascinating.
We end the episodes with a little fire round, a little rapid fire round if you're up for it. It's just like you can give as long as answer you want, but they're intended to kind of have short answers. But just before I ask you, I had one more thing that popped into mind just about your personal journey. If there's one ancient ritual that you still use personally that you've found that helps you. I know one's quite a tricky one sometimes.
One ritual that I use that helps me? Gosh, I think mantra meditation. Yeah. I think that's always grounding for me to help me focus on my mantra for the day, for the month, for the year. and to really tune into that. Yeah.
Amazing.
Yeah, so much evidence about meditation. So much, about expanding the brain, everything. Yeah.
No,
Yeah.
I'm
it's
all
amazing.
about protecting my prefrontal cortex nowadays. Yeah.
Yes, you need to keep a good brain. If we all want to be in this longevity space, we need a good brain, If we're all going to live to 180 or whatever, it's going to be no fun if you haven't got a good brain. So,
Okay, I'll fire around questions. Here we go. So the first one's morning sunlight, non-negotiable, or optional?
Non-negotiable. So much so that I'm going to show you. Oh, my morning sunlight partner here. This is Laura, right? So yeah, no, it is non-negotiable. We are always out in the sunlight, and if usually I walk 3 to 5 miles. So if she's not up, she's definitely not up for that. So we've got her in her after her first mile. We've got her in her little stroller, and we are getting sun.
So nice.
lovely.
Dogs are good excuses to get up.
Yeah,
early.
I got a little sunlight
on the clock. Second one was, leading on to mantras, meditation, daily must or depends on the person?
Depends on the person. At the same time, daily must. And the reason I'm saying that is because there's many types of meditation. Okay, so it doesn't necessarily mean sitting and just, sitting quietly for 30 minutes and trying to clear your mind. It could be a walking meditation. It could be, a breath work, pranayama. So I think some kind of practice is a must when it comes to your mind. And there are many options. In fact, I go over all of them in my book.
Perfect. We got another one to read. And balance, the concept of balance in health. Is it a real goal or a wellness myth?
I don't think of things necessarily we're balanced, but I think of healing in a more, not a single moment, but it's really these micro conversations happening between you and your body every day. So balance will look different every single day for you. So think about the micro conversations happening in your body.
Yeah, I love that. That's my key takeaway from this. It's something that I've been mulling on. So I will be reading your book and kind of taking that on board, because I think the more that we have that kind of inappropriate perception, I've even said the word wrong, haven't I? But more we can have and more knowledge of what's going on inside our bodies that we can then express. I think that is probably something that people don't talk about enough. Because we're kind of a little bit dictated to, you have your, you take this supplement, you do this. I've got my Aura Ring telling me to do, 12,000 steps or whatever. But, having that kind of being guided by yourself more, I think that's hugely important, and not enough people talk about that. So thank you. That's definitely given me food for thought today.
Yeah.
So, and it's really lovely to see you.
Yeah, no, your body speaks through your cells, right? So It's up to you to listen. It's up to you to nourish, and it's up to you to heal.
Yeah, for sure. Yeah, I'm totally down. Well,
one last cheeky question was just going to be, what's one wellness trend you wish people would stop chasing? Because obviously we're saying all the good things to do, but if there's one thing you could tell people to just...
One wellness trend to stop. Oh, this will open up a whole nother conversation and another episode. I think the wellness trend I would tell people to stop chasing is high protein. I said it. There you go. That just opened up another conversation.
Till the next episode. Read the book. Great.
Or maybe I'll even throw it out there. High animal-based protein. There you go. Now we really dropped a bomb.
Let's get some comments going.
Drop the bomb for sure.
I might have lost a few biohackers in that, but I'm happy to explain why I think so.
I think it's all good. I think that, people can follow you and find out. I'm sure you've detailed it in all your various things. So all the more reason to kind of check out what you're doing and the brilliant work. I'm looking forward to seeing you in London, and thank you so much for coming on the show.
Thank you for having me.
Yeah.
Thank you so much. We're excited to see you, and go check out the retreats. Make sure you get it on the waiting list if you're not on the waiting list, but there's those. And go read the book and go follow. And your Instagram handle, is it the best place for people
Yeah,
to get
Dr.
in touch with
Bhanote.
you? Dr. Bhanote,
Yeah.
there we go. Great. Thank you so much. And till next time.
Breaking the gray.